How long does it take for lip fillers to settle? I get asked this a lot. I understand why people ask me this, because most of my patients sort of talk a little bit out of both sides of their mouth, and I don't mean this in the sense of the lip. They talk out of both sides of their mouth because they like the volume of the lip filler, but they don't want their lip to look too unnatural. How do we change the lip, make it look bigger, but not make it look unnatural? And so they get this time where things are perfect. The night that I do it, usually they're a little unsettled because they see the swelling that's associated with the lip filler, and that makes them a little nervous. The next morning, they may still be a little nervous. By the following evening, a day afterwards, they're usually quite happy because they have the lip filler and they have some swelling, and patients like a little bit of the associated swelling. Within a week, they have their result, but there is that little bit of unsure time as the lip changes size, as the swelling changes. I try to counsel my patients that they'll go through this phase, and even though I know there's going to be some swelling, I don't know how much swelling there will be in that individual. And a little bit of swelling in the lips makes a big change. And so I've got to tell them to be ready for some range when they look at their lip. I think within a week, they mostly have their result. So that's how long I think that it takes for it to settle. What will my lips feel like after getting fillers? For a few days, the lip can feel a little bit funny. It can feel a little hard. And I notice that patients, some of this unsettled feeling about it feeling unnatural, patients make worse by putting their tongue to their lip many times. And I will see a patient that comes back who's not sure of their lip result, and they come back to me and they're touching their lip a lot, and I tell them to not do that. And one of the problems is we have a very tactile organ that's nearby our lips that we touch it to. And if it feels a little bit off, we notice that. It's very different than having a scar on your back or on your leg where we don't really touch it much during the day. So I tell patients to not tongue their lips. Should I get lip fillers with a lip lift? Realize lip fillers create volume. A lip lift changes the ratio of the white lip, it shortens that, and it everts the lip. It doesn't actually change the volume of the lip, it pulls it out in this way. And that creates a little different dynamic. Some patients, after they get a lip lift, still need lip fillers to make them happy. They often don't need as much filler, and they don't need it as frequently, but they still want to get a little bit of lip filler to make them happy after the lip lift. Realize the lip lift changes the ratio of the white to the red lip, and it everts the red lip. It shortens the white lip and it everts the red lip. The lip filler actually puts volume into the lip itself. And so some patients need both. So that's my answer. And lastly, some patients will actually want a little bit of a lip flip by putting a little botulinum toxin along the border of their lip, getting rid of some of the squeezer muscle, and this complements everything. So the decision of what to do, surgery, filler, botulinum toxin, or some combination, is individualized with your practitioner. How long do lip fillers last? This is a question I get asked all the time. There's not a great answer for this, but it depends a little on you. So if you're tolerant and you don't mind your lip deflating a little more, it'll often last 7 or 8 months. But if you're intolerant and want that really poochy lip, that really voluptuous lip, you may get it at 4 to 5 months. So there's a range of how long it, quote, lasts. But really, that's the patient's tolerance. If you have questions about lips, about anything else relating to the face, I would love to help you. I'd love to hear from you. Call or email me today. I look forward to talking to you and to seeing you in my office. Thanks so much for watching.